Every single day, more than 150 people die from pancreatic cancer, often without ever knowing they had it. Why? Because this cancer hides in silence, showing almost no obvious symptoms until it's too late. By the time most patients are diagnosed, treatment options are limited, and survival rates plummet. But here's the truth that doctors stress. Your body does give subtle warnings. You just need to know what to look for. If you or a loved one are over 50, ignoring these signs could be fatal. Stay with me, because recognizing these 7 silent symptoms early could save your life. Sign number 1, persistent upper abdominal or back pain. One of the earliest and most overlooked warning signs of pancreatic cancer is persistent pain in the upper abdomen that often radiates to the back. Unlike common back strain, this pain doesn't improve with rest or posture adjustments. It may start as a dull ache, but gradually becomes more consistent, especially after eating or lying down. The reason? As the tumor grows, it presses against surrounding nerves and organs, triggering discomfort that many dismiss as muscle soreness, indigestion, or even arthritis. Seniors, in particular, may ignore it, assuming it's simply a part of aging. But here's the urgency. If abdominal or back pain lasts for weeks, worsens after meals, and doesn't respond to usual remedies, it must be investigated. Doctors can use imaging tests such as CT scans or MRIs to rule out serious issues. Remember, early-stage pancreatic cancer is treatable, but only if caught in time. Don't brush off recurring belly or back pain as just getting older. Persistent, unexplained discomfort may be your body's alarm bell. Sign number 2, unexplained weight loss and loss of appetite. Unexplained weight loss is another silent sign that many seniors dismiss. Losing weight without dieting or exercise might sound like a blessing, but it can be a serious red flag. With pancreatic cancer, the tumor interferes with the body's ability to digest food properly and absorb nutrients. Patients often notice a reduced appetite, feeling full after only a few bites, or a sudden aversion to foods they once enjoyed. This change is not normal and should never be ignored. Medical experts warn that losing more than 5–10% of your body weight within 6 months without trying is cause for urgent investigation. While stress, thyroid issues, or diabetes can also cause weight loss, when combined with abdominal pain or fatigue, pancreatic cancer must be ruled out. For seniors, where appetite changes are often attributed to just age, this sign becomes even more dangerous. If your clothes suddenly feel looser, the scale drops rapidly, or meals no longer appeal to you, don't dismiss it. Consult your doctor. Catching this early could mean the difference between life and death. Sign number 3, jaundice, yellowing of eyes and skin. One of the most visible but often ignored signs of pancreatic cancer is jaundice, yellowing of the skin and the whites of the eyes. This happens because a pancreatic tumor can block the bile duct, preventing bile from flowing properly into the intestines. As a result, bilirubin, a yellow pigment, builds up in the blood and causes discoloration. Many people first notice this in subtle ways. Their eyes looking slightly yellow, their skin feeling itchy, or urine turning dark brown like tea. Stools may also become unusually pale or greasy. While liver disease or gallstones can cause similar symptoms, the urgency lies in this. Jaundice, caused by pancreatic cancer, often appears before other severe symptoms. It's one of the earliest outward warning signs, and it should never be ignored. If you or someone you love develops unexplained yellowing, especially alongside fatigue, abdominal pain, or weight loss, get tested immediately. Doctors can use a simple blood test and ultrasound to confirm the cause. Early action here can save your life. Sign number 4, digestive issues and bloating. Digestive changes are often brushed off as minor problems, but persistent bloating, indigestion, or greasy stools may point to something much more serious. Pancreatic cancer interferes with the pancreas's ability to produce digestive enzymes which help break down food. Without enough enzymes, fats are poorly digested, leading to diarrhea, foul-smelling stools, or stools that float and look oily. Patients also report feeling bloated or nauseous after eating, even when the meal is small. These symptoms are easily mistaken for conditions like irritable bowel syndrome, IBS, lactose intolerance, or food sensitivities. But when they become constant and are paired with weight loss or fatigue, they are not just digestive issues. Seniors in particular often self-treat with antacids or over-the-counter remedies, which may mask the problem without addressing the cause. The urgency here is clear. If your digestive system has suddenly changed, if you notice persistent bloating, changes in bowel habits, or greasy stools, seek medical advice. These subtle digestive clues could be an early alarm from your pancreas, giving you a rare window of opportunity for detection. Sign number 5. New onset diabetes after age 50. Diabetes is common among older adults, but when it appears suddenly after the age of 50, especially without a strong family history, it may signal pancreatic cancer. The pancreas is responsible for producing insulin, the hormone that regulates blood sugar. When a tumor grows, it disrupts these insulin-producing cells, leading to diabetes. Many people dismiss new-onset diabetes as a normal part of aging, but research shows that nearly 1 in 10 cases of sudden diabetes in seniors is linked to pancreatic cancer. Warning signs include sudden blood sugar spikes, unexplained weight loss, or difficulty controlling glucose levels, even with medication. Doctors emphasize that if diabetes develops abruptly and is paired with other red flags like abdominal pain, jaundice, or fatigue, further testing is needed. For seniors, this is especially urgent because diabetes is so common, it often masks the underlying problem. If you or someone you know is diagnosed with late-onset diabetes, don't just accept it at face value. Ask your doctor to investigate pancreatic health. Early screening could reveal what's hiding beneath the surface. Sign number 6. Metallic taste, fatigue, and nausea. Another silent sign is a persistent metallic taste in the mouth, accompanied by nausea, loss of appetite, and extreme fatigue. This occurs because pancreatic cancer disrupts digestion, causing toxins to build up in the bloodstream. These toxins alter taste, making food unpleasant or metallic. Patients often lose interest in meals they once enjoyed, leading to further weight loss and malnutrition. Nausea and fatigue are easily dismissed as side effects of medications, aging, or everyday stress. But when these symptoms become persistent and combine with digestive problems or abdominal pain, they should raise alarm. Fatigue in particular is a red flag. Cancer cells consume energy aggressively, leaving the body drained even with adequate rest. For seniors, this symptom is especially dangerous because tiredness is often attributed to just getting old. The urgency is simple. Don't normalize persistent fatigue, nausea, or metallic taste. These could be your body's way of signaling pancreatic trouble. If these symptoms linger for more than 2 weeks, seek professional medical evaluation without delay. Sign number 7. Blood clots, or itchy skin. Unexplained blood clots are a surprising but well-documented early warning sign of pancreatic cancer. This happens because cancer alters the blood's chemistry, making it more prone to clotting. Seniors may suddenly develop swelling, redness, or pain in the legs, signs of deep vein thrombosis, DVT, without any clear cause. In other cases, pulmonary embolism, a clot in the lungs, may occur, causing sudden chest pain or difficulty breathing. Additionally, Itchy skin without a rash can also be a clue caused by bilirubin buildup from blocked bile ducts. Both signs are frequently mistaken for unrelated issues: leg pain from arthritis, skin dryness, or circulation problems. But here's the urgency. Blood clots, without clear risk factors in seniors, must always be investigated for hidden cancers, especially pancreatic cancer. If you notice unexplained swelling in the legs, sudden shortness of breath, or constant itching, don't ignore it. These are not minor annoyances. They could be life-saving signals that demand urgent medical evaluation. Pancreatic cancer doesn't shout, it whispers. The 7 silent signs are persistent abdominal or back pain, unexplained weight loss, jaundice, digestive issues, sudden diabetes, metallic taste with fatigue, and unexplained blood clots or itching. Each of these may seem harmless on its own, but together they can point to a deadly disease. The key message? Don't ignore your body's whispers. Early detection can make all the difference between survival and late-stage discovery. If you've noticed any of these signs, consult your doctor immediately. Share this video with friends and family over 50. Awareness can save lives. And if you found this helpful, subscribe for more senior health insights, because your health deserves clarity, not confusion.